Welcome back everyone, Dr. Naveen here again from UPSC MEDICO. So we're discussing genital tract infections topic from gynecology for exam UPSC CMS. Not only for UPSC CMS, any MCQ based exam, we all know how important bacterial vaginosis topic is. Okay, there would be one question at least. Okay, in most of the spotter based exams, they're asking about clue cell nowadays, including USMLE. We'll try to understand what is this condition called bacterial vaginosis and why it is called osis rather than itis. But before getting into the details, I think you should know about this vaginal pH in detail. It forms a basic concept or a pillar to understand the topic bacterial vaginosis. So that is what is the normal vaginal pH. Normally the vagina is acidic. Acidic environment is always protective, right? Why stomach is acidic? Because whatever we eat should be dissolved in acids first. So vaginal pH is usually acidic and it ranges between pH 4 to 5.5, pH 4 to 5.5 and average being 4.5. The vaginal pH is 4.5. Now, what is that acidic? The acidic pH, it is mainly because of presence of multiple factors, but one factor which is contributing is Doderlein's bacillus. Doderlein's bacillus, which is present in the vagina. Doderlein's bacillus is present in the vagina, which maintains this acidic pH. Now, how estrogen plays a role? Estrogen is also important to maintain this acidic environment. That's the reason what happens whenever there is death of Doderlein's bacilli, whenever there is estrogen deficiency, the pH will move from acidic to either normal or alkaline. That increases the risk or chances of infection leading to STD, sexually transmitted infections. Hope you got my point. So these two factors are important. Now, how this acidic environment comes into picture? See, vaginal epithelium is usually exfoliative in nature. There will be rapid replenishment of vaginal cells. So this exfoliating vaginal cell contains, so exfoliated vaginal squamous cell, inside it contains glycogen. So the glycogen which is present in the exfoliated squamous cell is converted to lactic acid. Is converted to lactic acid by our Doderlein's bacilli. Doderlein's bacillus. So because of this lactic acid, the pH is acidic in nature in the vagina. Hope you got my point. And this mechanism is dependent on our very own estrogen. So if there is either estrogen deficiency or death of the Doderlein's bacilli because of any infection or because of antibacterial therapy, antimicrobial therapy, it all leads to loss of this lactic acid, which in turn predisposes to STDs. So let's also try to learn few more points about this Doderlein's bacilli. Doderlein's bacilli is a rod shaped. Bacilli means rod shaped, right? So common sense. It's a rod shaped bacilli. It's a rod shaped one, and it is a gram positive. It's a gram positive bacilli, and it grows on anaerobic media, anaerobic acid media. It's an anaerobic organism, and immediately within 3 to 4 days of birth, okay, it will appear in the vaginal tract. Okay, now after that it disappears in 10 to 14 days, 10 to 14 days of birth. So it appears close to first week, it disappears in the second week. Okay, now after that it will only appear again at puberty. It again reappears. Now at menopause it disappears. After puberty there would be sexual coitus, right? So it is protective. Menopause, there's no need, it disappears, but it again predisposes to STIs, not STIs, we will call it as genital tract infections at the later part because of the lack of this Doderlein's bacilli. In the initial neonatal period also it protective. So I can say that the vaginal pH varies during different phases of life cycle and during different phases of menstrual cycle. So the site from where they come from intestine. They are intestinal bacilli which migrate to the vagina. So these are the basic points that I would like to tell you about what is the vaginal pH in general, or usually what is the pH, vaginal pH. Now, as this vaginal pH is affected, if this vaginal pH instead of being average 4.5, if it is more than 4.5, what I am expecting? I am expecting a condition known as bacterial vaginosis. So that's the reason I started telling you that you should know about this vaginal pH. Right? So this Doderlin bacilli is a lactobacilli. So there is decrease in lactobacilli. When this protective bacteria is decreased, the balance will shift towards increase in Gardnerella vaginalis. Gardnerella vaginalis. Apart from Gardnerella vaginalis, the other anaerobic bacteria like bacteroids will increase. Bacteroid species, and even Peptococcus species, they will also increase in the vagina. Even Mycoplasma hominis will increase. Mycoplasma hominis will increase. Whenever the vaginal pH is high, whenever the acidic environment is lost, whenever there is a decrease in lactobacilli, the other counterparts, they will increase and they cause vaginal infection. And this infection, which is caused because of the imbalance, is categorized. It is categorized by no inflammation. That means there is no inflammation here. Yes, there is an infection, but inflammatory changes are absent. That's the reason instead of calling it vaginitis, they have given name vaginosis. If you understand this concept, I think you can answer many number of questions. Why it is not bacterial vaginitis, only vaginosis? Because this infection is characterized by absence. There is no vaginal inflammation because of this. There is no vaginal inflammation. Now, what are the clinical features you expect here? The clinical features which we can expect in case of bacterial vaginosis are, first and foremost, yes, there is a vaginal discharge. And you know, this discharge is malodorous. Malodorous, that is bad smell. Okay, malodorous vaginal discharge. And it is homogeneous. And what is the color? Color is very important to rule out in the option. That is, it is grayish white in color, malodorous, homogeneous, and it is adherent to vaginal wall. It is attached to vaginal wall. It is adherent to vaginal wall. Now, when I say malodorous, what kind of smell you expect here? You expect fishy smell. Remember this. So fish-like smell or fishy smell, homogeneous, grayish white, adherent vaginal wall. So any discharge characteristics are important for exam point of view. So mainly bacterial vaginosis is characterized by homogeneous vaginal discharge. Now one more thing I would like to tell you here is that it is associated with some of the complications. If this bacterial vaginosis occurs during pregnancy, it is very risky, because in pregnancy it can lead to miscarriage, mainly in the second trimester miscarriages are expected in pregnancy because of this bacterial vaginosis occurring in pregnancy. Yes, it can also lead to premature rupture of membranes. It can also lead to preterm birth and endometritis. So what are the pregnancy related complications associated with bacterial vaginosis? It is preterm birth, endometritis, and PROM and miscarriage. In general, normal complications are also there. So what are the normal complications you expect in case of bacterial vaginosis? It can lead to development of pelvic inflammatory disease. It can lead to pelvic inflammatory disease. If there is bacterial vaginosis, it is superseded by infection by other genital organisms like Trichomonas vaginalis, Pseudomonas, etc. Right? Chlamydia. Now, coming back to the diagnosis part. For diagnosis of bacterial vaginosis, there is a specific criteria. This is again very important from exam point of view. We call it as AMCEL's 4 diagnostic criteria. Why it is important to remember number 4? Because there are 4 things in the AMCEL's criteria that you should know. Already with the basic discussion whatever we did, we know that the vaginal pH should be more than 4.5. This is one criteria. We know that there is a homogeneous vaginal discharge. Apart from these two, there are two diagnostic tests that we need to do. Okay, one, we look at the exfoliated vaginal cells. Okay, exfoliated vaginal cells. This is normal exfoliated vaginal cell in a pap smear, but this is clue cell. What is a clue cell? The vaginal cell is actually closely adhered by or covered by a lot of bacilli, which could be Gardnerella vaginalis, which could be bacteria or streptococcus, mainly Gardnerella vaginalis. So this is a clue cell, a cell which is almost pasted or almost covered with lot of bacilli is a clue cell. So presence of clue cell, it is also clue cells, that is more than 20% of cells in the pap smear if they are predominated by clue cell. Very important, like lot of MCQs in exams has come from clue cell. What is a clue cell? It is giving you a clue, like lot of bacilli are going and attaching to this particular vaginal exfoliated cell, giving a clue to us that it could be bacterial vaginosis. So the clue cells, more than 20% of the cells, is a criteria, one of the four AMCELS diagnostic criteria for bacterial vaginosis. What is the fourth one? See, we do a test, we generally do a test known as whiff test. Whiff test, remember this test, whiff test. So what is this whiff test? We'll talk about that. So this whiff test, what we do is, when you take a drop of vaginal discharge, and to this, if you mix with 10% potassium hydroxide solution, okay, when you mix it on a slide, there will be fishy odor or amine odor. So bad smell will come, fishy smell will come when you mix a drop of vaginal discharge in patient with bacterial vaginosis with 10% potassium hydroxide solution. So this is whiff test, right? This is whiff test. And if positive whiff test is also helpful in diagnosis of AMCELS. So these four should be present. The AMCELS 4 diagnostic criteria should be present if you want to make diagnosis of bacterial vaginosis. Now, simply to conclude this discussion, you need to know what is the treatment. The gold standard treatment, patients will respond tremendously if you give tablet metronidazole. Okay, tablet metronidazole. What is the dosage? 200 mg. Should be given 3 times daily for 7 days. So this is the treatment for bacterial vaginosis. Okay, if you need to give a vaginal application to prevent any obstetric complications, we can even go for local metronidazole gel, but usually such complexity is never asked in the exams. But one thing usually asked is, should we treat the partner? Okay, so partner should be treated simultaneously. The partner should be treated in case of bacterial vaginosis. Right, done. So this will conclude our discussion on an important topic, that is bacterial vaginosis.